The South Korean government eased COVID-19 restrictions less than a month ago. But on Wednesday, officials say they may consider reimposing some rules. The number of new cases and seriously ill patients is rising across the country. Daily infections reached a record 4,100 on Tuesday, and nearly 70% of beds in intensive care units are now occupied.
유행이 증가하면서
A major factor that has contributed to the increasing number of cases and that has made the hospital bed utilisation rate a bit worse is the increasing number of infections in the elderly.
Senior citizens were the first to be inoculated earlier this year, and health officials say part of the reason infections are rising is because their immunity is waning. The government says it will give them booster shots.
What the government is trying to do at this point is to expand the deployment of booster shots, especially among the most vulnerable, as quickly as possible. They're increasing testing, especially in congregate residential settings, such as nursing homes and long-term care facilities.
Officials are also conducting test and trace operations after more than 200 people tested positive for COVID-19 at a church in the city of Cheonan.
아침에 중대본에서 천안시
In the morning, the Central Disaster and Safety Countermeasure Headquarters reported that around 91.4% of the confirmed cases from Cheonan were unvaccinated.
The increase in infections so soon after restrictions were lifted will be a blow to many. But although the number's rising, there's some relief that at about 35 a day, the number of deaths remains relatively low. Florence, Looi, Al Jazeera.